Everyone, welcome to the Pharmacy Market and Discussion. What do you need to know in 2025? I'm Stevie McIntyre. I'm the head of marketing here at Locum, and I'm joined by John and Jason, who are going to do their intro shortly. But thank you firstly for joining us this evening. It's fantastic to have so many people registered for the webinar and also so many people attending live. So we're going to cover a lot this evening, and we'll hopefully have it all complete within the hour. And there'll be the opportunity for attendees to ask questions throughout the webinar, and we'll also have a Q&A session at the end of the webinar. So what are we going to cover today? We're going to do welcome and introductions as usual. We're going to do an overview of Christie Co's PMR findings. We're going to do workforce challenges and look at the shifting locum rates. And Jason's going to take us through that in detail and talk around internal factors that impact rates and external factors that impact rates. And then we're going to end with a Q&A. There'll be the opportunity, again, like I said, throughout the webinar to ask questions. And if it's really pertinent at the time of talking, we can answer the question there and then. But if it's not, we'll pick it up in the Q&A. We're really interested in a lot of really interesting data going to come out of this evening's webinar. So hopefully it's a great discussion point, and we do want the debate as engaging as possible. So please do feel if you have something you want to add to the insights and findings, then please do write in the Q&A box. With that, I'll hand over to John, who'll do his introduction.
Thanks very much, Stevie. I'm John Board from Christie Co, head of pharmacy here. Just by way of introduction to Christie Co, if you want to flick on to the next slide, Stevie. Christie Co is a leading business property advisor with offices all across the UK and Europe. Being established back in 1935, the company's just celebrated its 90th birthday, and therefore has got a wealth of experience in providing brokerage and valuation and consultancy services across a range of sectors. In the last 5 years alone in the pharmacy space, we've advised on, valued or sold over 4,500 pharmacies with a combined value of over £3.5 billion. So the experience is wide ranging. At Christie Co, every year we do a pharmacy market review, analyse the trends, look at the market, see what's happening. The 2025 edition is due to be released next week, ahead of the pharmacy show the following weekend, and we thought this would be a really good opportunity to pull a few bits out, bit of a teaser as such, and go through some of the data that we found. If anybody wants a full copy, which will make good reading, it will be available on our website to everybody, and if you want a hard copy, come and find us at the pharmacy show when you can pick up a copy for yourself. We've had the benefit of the Locum data for quite some time. We've used it in many of our reports, and this year is no different. I won't be talking about that. I'll leave that to Jason in the section that comes up to follow. But on the next slide, Stevie, you can see here that the trend really of a reducing number of pharmacies across the UK has continued. The numbers have been reducing fairly significantly, although I think the peak reductions were between 2022 and 23 and early 2024. But the fact remains that there are a decreasing number of pharmacies across the country offering access to patients. One thing of note is that there were 784 former 100-hour pharmacies. And following a freedom of information request that we made, it's been demonstrated that 35% of those 100-hour pharmacies did reduce, when permitted, their hours down to the minimum of 72 hours a week, and another 40% reduced the hours down to between 73 and 80. So effectively 3/4 of them have managed to make significant reductions to their hours, and as a result of this would have made some good savings on their wage costs at a time when there's been significant cost pressures to those businesses. On the next slide, Stevie. The buyer activity has remained relatively consistent. I mean, this has been a sort of a direction of travel for a number of years. But the lion's share of all of the deals that we've done over the last 18 months have been to either first-time buyers, small independents, and sort of small operators. You can see there that over 75% of all of the deals that we've done have been to those sort of more agile, local, smaller groups who, in many cases, have seen the opportunity in a corporate disposal or an acquisition that's sort of in their area, where they felt that they could offer something different or be more in tune with the local community's needs, and buy those businesses and take those businesses forwards, which has been a real positive. One of the slight frustrations and downsides that we've noticed over the last 12 months is the delay or the elongation of the transactional times. You'll see there that from an average, it's taken 36 weeks to get deals done, and I think everyone in the market is a little bit frustrated at that, whether you're an accountant, a bank, an agent, or sellers and purchasers. I think everybody would like to see these things move quicker, but there is, as you'd expect with regulated businesses like pharmacies, a lot of hoops to jump through. And say the share sales are quicker. You don't have the NHS requirement for change of ownership, but the asset sales at 41 weeks have definitely had the timelines pushed out. I think the difficulty is trying to streamline that, and it's actually quite difficult. So I think that we would like to think that those dates will shorten somewhat, but I think they're a few weeks worse than they were last year. Next slide. With Christie Co, every year publish a sort of a price index, which effectively monitors the average price of the pharmacy sold, and you can sort of see that the last couple of years there has been a sort of a negative number. This year was released in January, showed a decrease of minus 6.3. Doesn't mean necessarily that the prices have fallen. What that does show is that the average of what is being sold is smaller, and that ties in with the large number of corporate disposals that we've seen and sort of divestments of either non-core or non-performing assets. I think that the chances that the significantly large retirement sales happening in the last year or two have sort of been outweighed by the influx of those sort of smaller corporate disposals, and therefore that price average is decreased. We're selling more pharmacies, but slightly smaller overall valued pharmacies. However, anecdotally, we are starting to see the sort of average price per deal increasing, particularly over the last 6 months. So I would imagine that when we get round to January, it may not be a positive number, but it will certainly be a smaller negative number. On the next slide, one of the new things that we've done in our sentiment in our survey this year is put out a survey to the market, and we engaged and we asked for the views from, I think, just over 7,000 pharmacy professionals, and there is quite a section in our pharmacy market review of all manner of questions. But I pulled a few out just to give a bit of a flavour of what's been asked and what sort of information has been provided. The first one here was obviously quite sort of important, and it concerned the pharmacy funding that was announced back in March, and we really took a straw poll around what was the view, and overwhelmingly you can see there that 78% of people were either disappointed or felt that it could go further. I think what was interesting was some of the actual comments that came, and I won't read all of those, but effectively the increase in single activity fee was welcomed, but it wasn't the sort of the golden egg that everyone was, well, some people would have been hoping for. I think many people will have been realistic about what was likely to come down the line, but it gave a welcome increase in the short term. But I think, as was said at the time, the proof is in the pudding in terms of the ongoing discussions and ongoing dialogue around the next deal. So there was some I guess, some cautious optimism around some of the comments. The next question on the next slide is really around sort of growth and opportunity, really. Appreciate this is maybe a little bit small, but the vast majority of people saw weight loss medication, the sort of other private services as the most likely route for increased growth. Pharmacy first was obviously mentioned. I think most people, accept that they'll probably be doing more items as well. But I think the biggest growth areas were those private services, additional services, and specifically weight loss, which was mentioned. I think on the next slide, there's a few more questions around sort of future plans and any sort of issues. The coming 3 years, what are people's plans? And again, the vast majority of people are looking to do something. Now, that's good from everyone's perspective, because whether you're selling, buying, it means there's activity, it means there's investment, it means that there's sort of the transactional markets will be turning. Nearly 2/3 of people there what we're looking to do one or the other or both. So that's obviously positive from our perspective. But notwithstanding that, clearly there remain significant challenges within the pharmacy market, and I think cash pressures are always front and centre. Cost pressures around cost of drugs, cost of staff, cost of fixed overheads, rent, rates, utilities, all of these things are a significant challenge to pharmacy operators, and certainly not one to be underestimated. But I think many of these smaller regional agile operators have the ability to maybe run things slightly tighter than some of the larger operators and some of the corporate operators, and therefore focus on the local community, focus on some of their private services, additional services, and can make a success of a lot of these businesses. So I think underneath all of this, yes, there are many challenges and significant challenges, but I think there is some cautious optimism around certainly a certain part of these operators around moving these businesses forwards and getting them onto a profitable and sort of sustainable footing. I mean, that pretty much sort of concludes the whistle stop tour. I'll hand over to Jason to get into some of the nitty gritty on the actual staffing costs.
Yeah, because as you mentioned there, like the staffing cost is a big concern for a lot of organisations. So hopefully some of the insights that we have here will help give some insights around that there. A little bit about LAL, or located Locum. We kind of just call it LAL internally, but we found increasingly lately a lot of our customers are now calling us LAL as well. We are an award-winning technology company. Most recently was last Thursday night. We won an award locally here for our development team. And really our role is connecting locums with pharmacies across the UK. We have a wide range of businesses that are on our platform, pharmacies from small independent single branches right up to the multiples. And then we do have a very wide pool of locums as well, of over 44,000 locums across the UK. And it's our role is to connect those businesses with the locums and connect those locums with the businesses so those shifts can be filled. We're not quite a dating app, but it's the same idea. We're all about connecting people and fulfilling those shifts and keeping businesses moving smoothly. To date, we've posted almost 3 million shifts on our platform. So because of this, there's so much data that is flowing through our platform, which really helps us deliver some insights when it comes to some of the workforce challenges, and some insights around rates around that there. Steve, if you want to skip forward, next slide. So how did we get all the data that we're about to present on? So what we do is we analyse a range of locum pharmacist shifts over a set period of time. So this was around a year. It was over 200,000 shifts that we analysed to be able to give this data. So that allows us to give some averages across the UK and averages regionally to provide those insights. And we'll be able to share the report at the end of this presentation. Likewise, we will also be at the pharmacy show. So if you want to come along and meet with us there or get access to any of this data, we'll be happy to provide that. But we're able to analyze that, and because of that there, we're able to provide the most sort of comprehensive locum rate study across the market, simply because of the volume of shifts that are going through the platform. Now, we know there are a lot of challenges within community pharmacy. You don't need to spend too long on a Google search or a ChatGPT or something like that there to find some of these sort of headlines and some of the pressing challenges. We know to talk about the workforce crisis, critical staffing pressures across community pharmacy, and then even with new initiatives like the likes of Pharmacy First coming along, how can that be supported? How can businesses roll that service out effectively and have the staff there to manage that? So that really is where the locum workforce really steps up and plays its part to help meet some of these challenges which community pharmacists are facing. On the next slide there, this gives you a bit of an overall view of where things are at when we look at rates. So this is kind of the big drum roll thing where we sort of analyze the market rates across the UK and across the individual regions. So you can see overall, the pharmacy sector and the locums in particular, it still is being effective. Across the UK, it has gone down by 5.5%. Now, positive note is this is less than last year. Last year it had dropped by, it was around 7%. It's just at 5.5%. But if you look across the individual regions, some of the regions are more affected than others. So the likes of England and Scotland has been a higher impact. Wales, not so much of an impact. Northern Ireland, strangely, has the rates have actually gone up in Northern Ireland. And there is some anecdotal reasons behind that. Like we know, for instance, in the Republic of Ireland, the pharmacy sector is quite buoyant. It's quite profitable for a lot of businesses that are operating there. So you find places like, say, like the northwest of Northern Ireland, up around Derry and stuff, a lot of locums will prefer to nip across the border into Donegal, work shifts there. They'll earn more money there. So that creates challenges in filling shifts. So the rates are starting to go up to try and attract those locums to work in those areas and to support that. But overall, it has gone down slightly. And there's a lot of factors that sit behind this, like the pharmacy market. There's overall market conditions that the pharmacy market is. Things that there. We are starting to come out of that now, thankfully, but it wasn't that long ago. We were discussing how challenges inflation was and everything like that there. And that was driving more demand for maybe job security as opposed to working as a locum. And this can affect the marketplace. We know that previously, when you look at the COVID period and coming out of that there, it was very much a sort of candidate driven market. But now it is, certainly more of an employer-driven market. And there's reasons behind that there, but we'll not get into them too much in this here. But there is that sort of query that some people find: how do we attract locum talent? How do we get locums into our shifts? So if we go through some of the other sort of headline stats around this, and we start looking at sort of the highest sort of average rates by city, you can see there up in the north of Scotland, likes of Inverness and Dundee and Perth and places like that there. Every time we've done this rate study, these are the areas which are the highest rates, and these are sort of particularly hard to fill regions. It doesn't matter what business that we work with, they all say the same: these are hard to fill regions. One of the biggest challenges of that is there is a shortage of locum pharmacists in those areas. So you think of somewhere like Scotland, they'll go down to the Central Belt to study, and they'll stay in the Central Belt. They'll start to build their lives there, and then it's up to the pharmacies. Okay, how do we attract these students back to the north of Scotland? People who were maybe get into pharmacy because of a family member or something like that, and they've moved away. How can we start to attract them back? Some of the studies that we have done, this is something that we would ask quite frequently with some of our local research and stuff like that, and sort of asking the question, what would attract you to work in a specific area or one region over another? And the cynical side of you will say, well, it all boils down to pounds and pence. You know, if you get paid for A in one store and B in another store, you'll go for the other store. But when you actually drill down into it, there's key factors that really make an impact on people choosing where they'll work. The busyness of store is one thing. You know, if they don't want to work in a really crazy store where they're just under pressure to dispense all day long, you know, that busyness of a store is a big factor. Another one, which is, you know, is second on the list, is the public transport, or even like something like access to parking. You think to travel into a busy city like London, travel costs or parking and things like that can be quite prohibitive, but somewhere more local, that can be more attractive. But rates is an important part of that there. So it's really key that for businesses that they're getting those rates right, and putting rates out there that will attract the right talent. So that's the highest rates. If we go to the lowest rate, you can see again, this is the sort of more common areas that we see. So areas where we know there is a greater concentration of pharmacists, and there's a lot of sort of pharmacy schools there. So places like London, across the Midlands, Leicester and whatnot, you have a high concentration of students who are graduating and living and working in those areas. So you have a massive oversupply almost of locums, and there isn't necessarily the demand there. So because of that there, the rate comes down. There's more competition for shifts. There's more people applying for shift. They'll negotiate down in order to secure that shift. So because of that, areas like London and Wolverhampton, we see lower rates. Now, these have dropped only slightly from last year. It does seem to have stabled a bit. And we know that these sort of things can be quite cyclical. Rates can go up, rates can go down, and it is all those external factors that would make an impact on that there. You think of like Northern Ireland is quite a small geographic area. Rates are traditionally low there because you have a couple of pharmacy schools, and you can basically, if you live anywhere in Northern Ireland, you're only an hour away from somewhere else in Northern Ireland. So people can work all over, whereas you think if someone's based in Manchester, you couldn't work all over England. So there'll be a greater concentration of an area of where you can work. So that has a real impact, and which is what sort of drives some of these lowest rates across the UK cities. If we go on to the next slide, then we can see that some areas are down, some areas are up. That's the combined UK average of a 5.5% reduction. And this should provide some respite. We know there has been sort of challenges within employment within it. This is a smaller reduction than last year, and it does seem to be balancing out after the sort of highs of COVID, which is a positive thing for everyone involved in it. The lowest rates we're seeing in Wolverhampton, which again in that Midlands area is always traditionally very low, and again the highest being up in Inverness. So those sort of locational remote areas, we always see areas like Cornwall, places like that are locationally remote. They do have much higher rates. So it's interesting for locums, maybe someone just graduating and wanting to get out and explore the workforce. Don't stick to your local high street or something that is a 5-10 minute drive away. There's opportunities out there to work in different parts of the country, and there are opportunities we would see on our platform. Businesses offering sort of stay away shifts where you can book for a block, go to somewhere in the north of Scotland or go to the likes of Cornwall and stay for a week and work there. It gives you an opportunity to see a bit more of the country, but as well for those people who have maybe studied in one of the sort of Midland areas and they want to get time back with family or see friends where they came from, their hometown. It's a good opportunity to explore this and spend some time back in those areas and do that there. So if we skip to the next slide there, Stevie. So like I say, the decline has been very slight compared to previous years, but there has been a decline. So some of the reasons around this, the likes of pharmacy first, we have saw that sort of increased demand for clinical responsibilities for the pharmacy workforce. So because of this tends to drive more sort of permanent recruitment. We know some businesses who want to push pharmacy first more, but they want their permanent staff to do that. They don't necessarily want locums to do that because they're not confident they have those accreditations or skills to do that. So that has caused this shift. Now that's something that as a platform we're sort of facilitating that ability for locums to upload credentials and provide that evidence that they do have the capacity to work these shifts, provide these services, whether it's weight loss or phlebotomy or whatever. So we're working with the locums to give them the ability to evidence the skills that they have, and that's something that we always encourage our locums. You know, the more skills that you can evidence, it makes you more attractive as a locum. And there is those non-industry related factors, so the likes of inflationary pressures. You think of the likes of the NI rates that come in, you think of even like the role of the IP coming in and the qualifications required for that. Being able to self-fund that can be quite expensive, but doing it through the workforce is a different route. So we know there's these different external challenges there as well. Even like what you mentioned earlier there, John, like the fact that some of these stores that maybe were open 100 hours, those hours taken down, less need for staff to fill shifts, less need for locums, they can use their employed workforce to do that. So this is impacting and causing that slight decline in rates that we've saw this year. But, you know, we know that impacts locum rate, but if you sort of follow the workflow here, there's the reliance on services like the Pharmacy First that has driven a focus on recruitment of permanent employees to deliver those services. There then is less of a demand for locums due to those permanent roles being filled. That leads on to a reduction in rates because it's due to that decreased demand. But like I said, what we're offering is that ability to evidence that skill up. So we advise locums, you know, skill up, the likes of Pharmacy First, the likes of weight loss, smoking cessation, all the different services, private services that pharmacies are offering. Skill up, provide that evidence that enables you to provide those services, and then request a higher rate because you have an improved skill set and you're able to meet those specialist services that they require. So if we skip on to the next slide, and this is kind of what we know from working with many businesses. Like what we're focusing on is that connection piece. We want to make sure the pharmacies stay open. We want to make sure that there's locums there able to fill those shifts. So the advice that we would give pharmacy owners to make sure that that happens is staying up to date with the current rates in your area so that you're always offering, you know, the best rate at the right time. Within our platform, we offer our market rate report. We offer market insights. We offer that to locums as well, so that we know that if you offer too low, you'll not attract anyone to fill that shift. And what happens is that shift will it'll sit for weeks, and then you then becomes an emergency shift because it's coming up to Saturday, you need someone to work it, and you have to put your rate right up before it fills. So getting a fair and equitable rate early as a market rate, getting that out, that'll fill the shift quicker. The earlier you can post the shift in advance, that'll be filled much quicker. We know that a lot of locums like a bit of certainty in their diary. What we've offered a lot is the ability to sort of book in blocks. So if you have someone that you know is going off for 2 weeks, that can be put up as a block for 2 weeks, and a locum could work those full 2 weeks for you. If they're posted further in advance, that gives someone a bit of confidence, gives them assurance in their calendar that those shifts, they know they've got 2 weeks of work there. So we get that out early, that shift gets filled, and then you don't have to worry about that sort of hockey stick effect where the rate increases exponentially the closer you get to the start of the shift. And one thing we always recommend is build a solid pool of talents. You know, when a locum comes and works in your store, build that relationship with them. If you have a locum who comes and you like their style of work, they've good understanding of your PMR system, they have good relationships with your team, you know, build that solid talent pool of locums that you can reach out to and you can assign shifts to get those filled as quickly as possible. So just skip to the next slide. Yeah. So as Stevie said at the start, there is internal and there is external factors that impact rates. The first one, which I've touched upon there, is that sort of speed of posting. If you're leaving at the last minute, you're going to end up paying a much higher rate because it's become an emergency shift. And just the ability to leverage technology, we have, you know, there's businesses on our platform post shifts 6 months, 9 months, even 12 months in advance because they know when their staff are taking leave, they know when they'll need cover, they know when the busy period is, they know when they need additional pharmacists in to cover vaccine clinics and whatnot. So the quicker you can get a shift posted, then that'll help your rates there. How you manage leave, just working with your own staff. Like, most people have a rough idea when they're going to take time off, whether it's religious holidays or family holidays or specific times of the year. If you can get that leave managed, you can forward plan, you can get those gaps filled in advance. The size of your locum pool, like I say, we've over 44,000 locums on our platform who are actively working. If you're trying to fill shifts from 2 or 3 people that you have their business card or you've got their phone number, stuff like that, that really restricts your ability to fill shifts and fill them at a rate which is equitable both for you and for the locum. So having a wider locum pool that you can avail of, better chance you'll get your shift filled, better chance you'll get it filled well in advance, and better shift you'll get it filled at a rate that works for both you and for the locum. Understanding what services are needed. The more services that you're providing means that locums can provide or command a much higher rate, because obviously they've evidenced the skills, the accreditations that they have, so that will impact the rate. How you source the locum, again, there's many people who use family and friends, there's people who use WhatsApp group, there's people who use agencies, there's people who use software platforms like ours, but having a robust process in place in how you source locums and making sure that they're compliant and you have evidence of everything and you've access to all that data, that will have a big impact on the rates that you're paying. And like I said before, being unaware of the best rates to offer, that works both ways. So you could put a shift on and the rate is too low and you don't get it filled, and then you're scrambling at the last minute trying to get it filled, and then worst case scenario, you don't get to open, or you have to pay absolutely through the nose to get someone to fill that shift for you. So putting a shift out at the right rate will make sure you'll get it filled. Conversely, you could be putting a shift out at much too high rate and you're paying over the odds for what so having that insight of actually what is the correct rate that I should be charging, the likes of our report gives you those insights, but being in the platform, you get live insights, and that that is evidence on a daily basis how that rate should be. So being that awareness of it is really important. Don't just go on a hunch, or don't just give a flat rate. If you own 10 branches, what is the right rate for each of those branches will be slightly different, unless they're all within a 2-mile radius. There'll be different rates for each of those stores. So having that insight and having that awareness to make sure you're posting shifts at the correct rate. But there's also external factors, and sometimes those external factors you don't necessarily have any control of at all, market conditions and the wider economy. As much as we would like to have a crystal ball to understand what's coming in the next few years, and we don't need to get into the politics of what's happening or what has been announced at the Labour conference this week or anything, but we know there's always volatility within the market, within the economy, and within politics. We can't control that there. The funding, which you touched on earlier, John, there's no real control over that. That will always provide constraints, so that'll impact what you can offer around rates. The seasonality is always there, but you can plan ahead and you can think of that there. The location where you're based as a business, that is an important thing to consider. Like, I'm sure, John, whenever you're advising people and buying businesses, like what they're paying for locums or what they're paying for pharmacists in that area is an important consideration when it comes into that buying process, because that will really impact your overhead when it comes to wages and stuff like that there. So thinking of your location, is there pharmacy schools close by? Is there a wide pool of candidates available, both from a recruitment perspective, but also from a locum perspectives? There's alternatives to community pharmacy, such as GP surgeries and whatnot. So that is an external factor. And you've also got things like online pharmacies now are becoming ever more prevalent. They're on the rise, and again, that's a challenge for employment, but it's also a challenge for accessing locums. But again, that can have an external factor on the rates that you're providing. And again, that pent-up demand for annual leave and holidays from your permanent pharmacist, if you can plan ahead for that and structure that there, that's great. But there will always be people who book 2 weeks holidays at the last minute, and then all of a sudden you're trying to fill shifts. So some of these things you can control, other things are outside of your control. But if you're planning ahead, you have a good process in place, you have a good system in place to manage it, and you have that access to a wider pool, that can help you overcome some of those challenges that you face. Go on to the next slide. Yeah. So if you're sitting watching this on a screen and you have a mobile phone in your hand, get it out now, scan the QR code, and that will give you access to give you that custom report. You can input your town or your city or where you live. That'll give you that data. You'll get the full methodology, you get the full data breakdown before that. And that's a really, really key insight for businesses when they're planning ahead. As we're coming into sort of Christmas and period, a particularly busy time within pharmacy, these are really key insights to have. So certainly a feel of that there. Steve, I'm sure, will be sharing these slides and recording and stuff after. So if you don't get a chance to do that, you'll be able to pick that up at a later date. I think that is all from me. We're now ready for some Q&A. I saw a few little hands pop up while that was going off. So I'm sure Stevie will be able to facilitate the Q&A session.
I'll give everyone a couple of minutes to put in some more questions. Someone has got one straight away, so we can get going. So I suppose this is for you, Jason. So how do you foresee the trend in the pharmacy markets in 5 years' time with 8 new schools of pharmacy? Will there be an oversupply of pharmacists?
I can't foresee us getting to a stage where there'll be an oversupply of pharmacy, because there is going to be an increased demand from the NHS to offer services. I attended an event a year ago, and I wasn't long sort of started with Locum, and I was listening to a lot of businesses giving insights into how they used to make so much money from the retail side of the business. Nobody goes to their chemist nowadays to buy their perfume or shampoo or stuff like that there. Everyone's ordering that online. And what a lot of these businesses were doing was sort of getting rid of that retail sector, and they were bringing in more like clinical spaces where they could offer services. Some of them was even offering aesthetics, but all your sort of weight loss clinics, your smoking cessation clinics, all those private services. So as that changes, as the NHS relies more on community pharmacy to provide these services, and businesses move away from retail and start to develop their service offering, there will be more demand for pharmacists within the market. It's good to see that out of that there is one that is in Bangor in Wales, because I say that is an area which has always been a challenge to fill shifts and get locums in. So it's great to see that some of those areas, they're not just in sort of the middle of England, like even down in Plymouth and stuff down in the south of England. They are widely spread out. So I think they'll really support the businesses that are out there and empower businesses to offer services and get away from that sort of old retail model, on top of the sort of the core services of community pharmacy.
Yeah, Jason, good answer. I think the 10-year health plan that the NHS outlined a few months ago also sort of states that pharmacy is going to be the front line of healthcare, and that the demand for pharmacists will only increase. So I'd say you're bang on with that answer. John, this one's for you. So as someone planning to enter pharmacy ownership in the next few years, what would you say are the key factors that will determine the success and sustainability of independent pharmacies in 2025 and beyond?
Good question. I think back to basics with a lot of this stuff. I think if you're looking to purchase a pharmacy, I think fundamentally you need to be very sure of your business plan, be very sure of your offering, be very sure of your location, your patients in that location. Every area is very different. Whether it's a council estate in the middle of some big city or a rural pharmacy down in Cornwall or Norfolk or somewhere like that, you've got to be very in tune with what those patients want. I think that's where the independents have a bit of an advantage because they, as I said a number of times in my previous piece, they can be agile, they can be accommodating to those needs of those people, but they just have to be sure of the numbers. And I think don't underestimate the the responsibilities of it being a business as well. I mean, a lot of pharmacists do want to be the pharmacists who own their own pharmacy, but there's a lot of extracurricular work, bookkeeping, accounting, all the stuff that you don't see that goes on in the pharmacy. There's an awful lot there. So I would certainly recommend a lot of prep, the right people around you, whether that's banks, accountants. Your business plan is going to be very important. The right solicitors at the time. There's a lot of prep. There's a lot of work that goes into acquiring your first pharmacy. But if you get the first pharmacy right and you get that process done and you get a good business that you can grow into and add value to, it will really lead you on to some fantastic things. But buying the first one is actually always the hardest because you can't, you don't want to get that wrong. You want to get the right pharmacy in the right location that works for you and that is exactly what you want. I'd much rather people take their time to get the right one rather than buying the first one that they think they have to, because if people are buying, particularly, I don't know the age of this particular person, but if you're going to be in the pharmacy for the next 10, 15, 20 years, this is a business that you can grow into and develop over an extended period of time.
Brilliant. Thank you, John. Two in a row for Jason and then back to John. So do you have any data/trends on shift cancellations, particularly where shifts are booked months in advance?
I wouldn't say we have any sort of trends around this. Where we sometimes see the challenge of is when shifts are posted months in advance is perhaps the reason behind that shift being posted. If it's to cover holidays, if it's just to cover specific gaps within schedules and stuff like that, cancellations are particularly low. The only time we ever see any sort of slight rise in a cancellation is if shifts are posted because say a pharmacist leaves a business, there's that short-term pressure of filling shifts. If a business posts those shifts months in advance and then in the interim they recruit a pharmacist and then there's no longer a need for a locum pharmacist to fill that shift, that would be the only time we would see any sort of correlation between cancellation of shifts that happen months in advance. We find the majority of businesses though are putting those shifts on months in advance because of the business pressures they have, because of leave or particular seasonality around things. So I wouldn't say there's a higher rate of cancellations between shifts posted weeks in advance or months in advance, but the reason behind that shift being posted sometimes can indicate why it may be cancelled in the future. But we know that shift cancellations are quite low. It's something that we look at very closely as a business, both from the locum side of locums cancelling shifts and from the business side of businesses cancelling shifts, because obviously we view very much as a business that we have two customers. We have the pharmacies and then we have the locums. So we monitor both of those, and I'm pleased to report that they are both very low. So say that's the only small indication of a trend there may be.
Okay, brilliant. Next question's for you too. Has there been a difference in rates between IPs, so independent prescribers, and non-IPs?
Absolutely. Say the more skilled you can be as a locum pharmacist, and if you can evidence those skills, then that is a really powerful thing to have in your toolbox, because there are businesses out there who are looking for our IPs, who are looking for locums who can provide certain services. So evidencing that on the platform is a really useful thing. It's something that we're developing more of, is that sort of on our platform when people post shift, they do shift requirements where they will ask for specific skill set to fulfill a specific shift. So it may be we're running a vaccine clinic, we need to have that up to date. But what we're sort of developing is that sort of matching process where, you know, someone has uploaded all their skills and their validation and they're looking for specific shifts that have those requirements. Then we want to be able to support both the businesses and the locums and being able to fill those shifts. So yeah, there definitely is a correlation, more skilled, higher rates.
Last call for questions before we ask this one to John. So get your questions in now, and we've got about 5 more minutes left. So John, this one's for you. So how are pharmacy valuations currently trending, and what should the potential future of buyers be most aware of when they're considering their first acquisition?
I guess the second half of that question was very similar to the previous one around sort of prep and all the rest of it. But in terms of valuations, which I think is probably a very interesting point, it varies massively. To be quite honest with you, there's a multiple of profit which people will normally pay for a business, and it's not the profit sharing the figures, but it's a reconstituted or adjusted net profit that people will pay a multiple of, and those multiples will vary whether it's run fully managed, i.e. with a pharmacist cost included, or if it's a slightly smaller pharmacy, excluding that. Now obviously the multiple will be lower on the owner operated businesses than the managed businesses, but I think what we've seen over the last 5 years, particularly when Lloyds were divesting 1,000 pharmacies, is, and anyone that will have looked at those figures will have known that there was no profit shown, that they intentionally sort of removed the gross profit, and that's not uncommon. A lot of the kind of group corporate operators do the same thing, but it meant you weren't able to actually identify a net profit. And so what people were doing, and what they used to do in the olden days, 15, 20 years ago, was pay a multiple of turnover. Now, I don't think that's the ideal route, because, as I say, there's a lot of variances around fixed overheads, fixed costs, and all manner of other sort of reasons why these things would differ. But when there's no profit or it's a loss-making business, people will end up paying a proportion of turnover. But I think that the banks particularly work on the multiple of profit basis, and it will be, as I say, adjusted for one-off costs and any sort of extremities, whether high or low, whether that's gross profit being very, very high or very, very low. There'll be an adjustment to what they would call a fair, maintainable level of trade. And as I say, those multiples for owner operated businesses are probably between 4 and 5.5, and for sort of managed businesses probably between 6.5 and 7.5, 8 in many cases. But there's a lot of variances around what the rent is, what the locations are, how big the business is, how profitable that business is, will have an impact on the multiple of profit.
Perfect. There's been no more questions, so I suppose that just leaves us to thank everyone for attending, giving up your evening. Really do appreciate it, and we know everyone who works in this industry is extremely busy, so we don't take it for granted that you attend evening webinars like this. And the engagement was really good, and some really great questions there. And I'd just like to thank John and Jason for providing that insight to the market. And from my side, you can get the recording post the webinar. We'll send that out to everyone who's registered. There'll be the opportunity again to download the custom rates for your city or your region. I'll include that as a hyperlink as well in the email communication. Jason, John, do you want to close?
Thank you for hosting. Obviously, a pleasure to be involved. As I said at the very beginning, I guess we'll all be at the pharmacy show. So if anyone's attending that, come and find us. And similarly, if you've got any particular questions or anything you think of after this, feel free to reach out to us. All of our details are sort of available on the website, or get in touch, and we will provide any information necessary.
Yeah, and for me, certainly Thank you, Stevie, for facilitating everyone. We will be on stand E10, I believe it is, at the pharmacy show this year. So you'll find me floating about and the rest of the team. So certainly come by, stop, grab a chat, and we'd love to see you there. But again, thank you for your time this evening. We really appreciate it, and hopefully you've found it useful and insightful. Thank you.
Yeah, everyone.
Thank you very
Good
much.
night.
Thank you.